Mumps virus. This organism, the virus is the one that is involved in the causation of the disease of the children, that is the mumps, which involves the parotid glands. Coming to the introduction part, mumps usually causes acute infectious disease which is characterized by the non-suppurative enlargement of the parotid glands, usually caused in the children about 5 to 15 years old, specifically causing diseases to the young children, that is between the 5 to 10 years old. It was first, this disease was first described by Hippocrates in 15th century, and the possible causative agent that is involved in the causation of the disease is a virus was given to us by Johnson's and the good pasture. Hebel in 1945 cultivated the organism in a chick embryo and was successful in cultivating this organism and identifying this organism. Henle and Dane Hart cultivated the organism in the tissue cultures. Coming to the properties of this organism, mumps virus is a typical paramyxovirus, and the paramyxovirus contains different groups of viruses that are mostly involved in the acute respiratory diseases of the infants and the children. And this mumps virus shows hemagglutinin and fusion proteins, and the organism has the virus have the ability to lyse the RBCs of the sheep, humans, guinea pigs, etc. And hemagglutination is followed by hemolysis and elution as 37 degrees centigrade. This organism can be very well grown in a chick embryo in the amniotic cavity for the primary isolation and allantoic cavity for the standardizations. And the inoculation is usually done in a chick embryo of 6 to 8 days and incubated at 35 degrees centigrade for 5 days. Coming to the cell cultures that are used for the primary isolation, you can go for the monkey kidney cultures where you can see the cytopathic effect very slow and in the form of a zinc shell formation. Zinc shell formation is nothing but the multicellular or multinucleated cells or the infected cells that are usually formed on a cell culture. So zinc shell formation is the primary isolation of these organisms in the cell cultures. Apart from that, the other characteristic feature is the production of acidophilic and intracytoplasmic inclusion bodies by these organisms, and the growth can be identified by hemadsorptions. The organism is highly labile in nature, can be easily inactivated at room temperature and by exposure to the formaldehyde, and can be preserved at minus 70 degrees centigrade or by lyophilization. The organism's antigenic structure is highly stable in nature and only one serotype is known, and it has two complement fixing antigens. One is called as the surface antigen that is designated as S, and the viral antigen which is designated as V. So based upon the production of the antibodies against this, you can identify the infection caused by this organism. Now coming to the clinical features, the organism usually enters into the person via the inhalation or sometimes through the conjunctiva. So this is the place, these are the places through which the organism can gain an entry when the person is in close contact with the infected person. And the organism once get established in the upper respiratory tract, they will multiply in upper respiratory tract as well as in the cervical lymph nodes, and the dissemination is usually takes place when the virus enters into the blood and reaches the different parts of the body. Incubation period of this disease is around 12 to 25 days, and the characteristic or the first sign that is identified as mumps is the swelling in the parotid glands. So here you can see there is a swelling in the parotid gland which gives the initial sign of this infection. Apart from that, the prodromal malaise can also be taken as an indicative like sign for the mumps. And the parotitis is parotid swelling is usually unilateral, but sometimes it can be bilateral in nature, accompanied by fever, local pain, tenderness, etc. Now here in this mumps disease, the skin is usually not warm and not erythematous in nature. So this is another indication about the mumps disease. And parotitis is usually characterized by non-suppurative lesion. You do not see any pus type of formation, and apart from that, there is an involvement of extra parotid site. The organism without causing parotitis can also enter into the other places of the body, that is called as the extra parotid site, which is more lethal, which is more serious when compared to that of parotitis. And apart from this particular specific infection of the parotid glands, you can also see this phenomena which is called as epididymoarchitis, mostly seen in 1/3 of the post-pubertal male, where the testes are usually enlarged and inflamed, and heavy pain will be there in the testes. So that is called as epididymoarchitis. And here this epididymo is accompanied with the fever and the chills. Coming to the orchitis is very rare, and it can be unilateral and sometimes become bilateral, where you can see that testis atrophies and decrease in the number of the sperms and can lead to sterility. So it is a very rare phenomena in case of mumps infection. There is an involvement of central nervous system for about 40 to 60%, and you can identify this infection with the help of pleocytosis, that is increase in the number of the WBCs, and rare involvement of meningitis can be seen. 10 to 20% of the aseptic meningitis case have been come forward, and meningoencephalitis and mumps meningitis usually resolves within few days without a sequel, but sometimes can lead to deafness in certain individuals. And mumps meningitis can cause without the involvement of the parotitis. Virus can be isolated from the cerebrospinal fluid in the initial stages of the diseases or in the early signs of this diseases. The other complication associated with this particular disease is oophorytis, myocarditis, thyroiditis, pancreatitis, etc. Coming to the epidemiology, this disease is endemic in nature, usually affecting the children between 5 to 15 years, and it has drastically come down after immunization procedures, and affecting only the young adults or the infants or the young adults which are in close contact, such as in the army camps. Household spread is common in this particular infection, and humans are the only source of infection. There is no reservoir and no carrier in this particular disease. Coming to the transmission usually takes place via the direct contact or use of fomites that have been contaminated with the saliva of the infected person, and aerosolized organism, etc., or droplet containing the virus. And the virus can be detected with the help of antibodies that are produced, or dissemination of virus or spread of the virus usually seen 1 or 2 weeks before the parotitis or the parotid glands are usually enlarged. So 2 weeks before that you can identify the virus that are usually shed by the person, and the peak infectivity is 1 or 2 days before the parotitis, and the person also shed this virus in the urine, but the causative role of the virus from the urine to transmit the infection is very rare and has not yet been reported. And once the person get infected with this particular disease, he will have lasting immunity throughout his life. Coming to the immunity, the response that is given by the host against this particular organism. So when there is an entrance of the antigen, the human body protects itself by producing the antibodies. So the antibodies are produced again 2 important type of antigen, that is the surface antigen, S antigen, and the V antigen. The antibodies against the S antigens are produced after 3 to 7 days, and usually represents the current infection, and they are eliminated within 6 months. So they do not give us a protective role throughout life. It is the antibodies against the V which are produced after 1 month that helps to protect the person from the further infections. Apart from that, anti-hemagglutinin antibodies also gives resistance towards this particular infection. The antibodies against the subclinical infection, that is towards the hemagglutinin inhibition antibodies are the one that can also confer immunity to the person. And because it is widespread in the individual, the passive immunity helps to prevent the person from this particular disease. Cell-mediated immunity can be activated and helps in the elimination of the infection, but the role of cell-mediated immunity is not as important as the humoral immunity, that is usually mediated by the antibodies. Interferons are also produced in this particular type of infection. Coming to the lab diagnosis for typical infection is not needed, whereas for atypical infection, where there is an involvement of meningitis or the systemic viremia, when it is there, in that case you can have to go for the atypical infection lab diagnosis, and it is usually established by virus isolation and the serological test. And the specimen that is used, as it is an acute respiratory disease, the specimen will usually be saliva, sometimes urine, and also the CFF. When there is cerebrospinal fluid involvement, you can go for the CSF also. And they are usually inoculated on the monkey kidney cells. The other cell cultures that can be used are HeLa cells or the human amnion. And the growth is detected with the help of heme adsorption. And now this can be identified with the test which is called as the heme adsorption inhibition test using the anti-sera. Now coming to the cytopathic effects, that cannot be taken into consideration because this syncytial formation can be done with the other paramyxovirus also. So that will not give you a perfect result to go for the treatment. Now to further identify the organism, you can go for immunofluorescence technique, where the organism that have been identified or grown in a cell culture can be taken up with the immunofluorescence technique to finally identify the organism. And apart from that, you can inoculate the organism or the specimen into the chick embryo, that is of 6 to 8 days, incubated at 35 degrees centigrade for 5 to 6 days. See for the growth of or see for the hemagglutinin after 5 days, and in order to confirm that, you can go for hemagglutinin inhibition test with a specific anti-sera. Egg inoculation techniques are less sensitive when compared to that of the cell cultures. Apart from this isolation, you can go for the serological diagnosis, where the antibodies that are generated against the S and B antigens can be considered as a positive disease signs. So here you can go for the antibodies that are produced against the S and B to indicate the presence of this disease. So usually it is said that the IgG antibodies that are produced usually shows a cross infection with the para-influenza. So in order to eliminate that particular thing, we can go for IgM ELISA. Here the IgG is a cross-reacting antibody, but it is not the IgM. So identifying the IgM is the indicative of the disease. Now coming to the control or the prophylaxis, live virus vaccines are usually given to prevent the person from mumps disease, and the strain that is used called as a Geril Lynn strain that has been grown in the embryonated egg fibroblast or serially subcultured on a egg. So while they are have been carried out subculturing for many periods of generation, they will lose their infectivity, and hence they can be used as attenuated strains to induce the immunity. So they are called as live virus vaccines. And this vaccine is given only after 1 year of age, because before that the child will be protected with the mother's passive immunization. Natural mother's passive immunization will be there, and hence it is only after 1 year that the children are usually given with this particular vaccination. And it is given as a single subcutaneous injection, either singly or in combination with the other vaccine, that is the MMR vaccine, mumps, measles and rubella vaccines. And the mumps immunoglobulin are of no clinical importance for the post-exposure prophylaxis or for the treatment. That is, once the person has been infected with disease, you cannot go with this mumps immunoglobulin. The only way is to treat with the antibiotic. So this is about the mumps.